Hey everyone, it's Sarah Egan here. I am presenting today on my problem of practice, which is a formative assessment system here at the Medical College of Georgia, or more of a focus on formative assessment. This is housed within a larger problem of practice or change process that we are going through as an institution. We are going through a curriculum redesign that started in fall 2020, which obviously an interesting time to start a new curriculum, which I'll kind of talk about that as well. And I'll dive a little bit more into my specific piece of it, which is the formative assessment. I thought the COGS assignment that we did was a really good way to sort of introduce this problem of practice and sort of let you know where my piece is of this sort of bigger, larger project. So if I kind of starting towards the left, the growing health needs of our state of Georgia. Just basically, we are in need of primary care physicians in almost every county of Georgia, excluding some in Atlanta. So the idea being we need to grow our medical program to sort of filter and feed more students, our medical students, our future physicians into our state. And then just sort of the growing innovations in medicine, especially specifically in the assessments world, moving away from sort of high stakes summative assessments that we've typically used in medical education for a long time. Those are still there. We call those assessments of learning. We're moving more towards assessments for learning, which is more of a formative assessment system. So that's sort of what a lot of people are talking about in medical education research right now. And then just obviously sharing ideas from other medical schools who have faced these sort of issues. And there have been other programs who have enacted these sort of assessment systems that have worked well for their students, and students tend to be more satisfied with them. So we worked to design the assessment system. It's a lot to do with continued quality improvement. We started an assessment subcommittee. We meet every 3 weeks, and we are kind of going through every course, every clerkship first, as sort of like a general sweep to see kind of where we currently are. And then we're going to dive in more to sort of are these assessments actually measuring what they're intended to? So that's sort of the charge of the committee. And then obviously a huge part of that is just feedback. So sending out surveys on a biannual basis to see if what we think we're doing, are we actually doing that? So the leadership theory I used to sort of frame this problem of practice was actually transformational leadership, which was intended to sort of change and transform people. I think this was a good theory to use because we already had a really good foundation here at the medical college. Things had gotten a little stale, I believe. At that point I had only been in the institution for a couple years, but from what I've heard from people who have been here for a while, things were just kind of getting stale. So we wanted to, or the leaders we're wanting to sort of shake things up and actually sort of build a curriculum that matches with what's going on within the medical education research. So the idea of, changing and transforming people through transformational leadership. So the characteristics of this that I think actually work well with this problem of practice are, it's purpose-driven, it's people-driven, and it's challenging followers to be innovative. So this is people in these roles have been doing things the same way for a long time, and we are challenging them to do things a little bit differently. And I had this quick little sort of diagram, and I'm going to talk about in the next slide, but sort of comes down to these three things that happen. Was first assessing the followers' motives, or even sort of what their current work is like, working to satisfy their needs, and then treating them like human beings. So the larger problem of practice really started with a new vice dean in 2018. He was very charismatic and he had grand vision for our institution. A lot of people rallied behind him when he first started. They could see what vision he was trying to have, and it wasn't all his vision. He actually met with his team, met with the staff members of those teams to sort of hear sort of what their general complaints are about the medical college at that time. A lot of these complaints had to do with sort of students' disinterest in lectures. A lot of students weren't physically coming to classes, which was an issue. And then there's so much stress around these summative measures and the STEP exams, which are national exams that students have to pass in order to go into residency. Students were so stressed and focused on those that they sort of ignored the curriculum. So he also did he does surveys all the time. He sends out to sort of see where the staff and faculty are on the change process. They actually use the change process model to sort of see where people are in the different units. In that actual survey, I pulled this line, which I thought was interesting. He seeks to get continued feedback. It's critical as we strive to evaluate and improve the implementation process, which is the new curriculum redesign. And then he also takes the data from those surveys as well as these meetings, and he works to fulfill the needs that are reported in these different avenues. We spent such a large portion of the class in Folin, so I wanted to spend a couple of different slides talking about it. So the first chapter was about moral purpose, and I really think this project had moral purpose in droves. The overarching goal was to create practice-ready graduates, all intended to sort of improve the health of our state. We want to incentivize students to stay in the state of Georgia to practice medicine. The overarching goal of sort of my specific problem practice is turning students or moving an assessment system of learning to assessments for learning, which is really intended to create self-directed learners and lifelong learners. And this sort of idea of having mutual purpose across the different interest groups. So just trying to balance what the students are reporting to us and what we are seeing as leaders. And then just a general note that this does not happen naturally. This is something we have to cultivate, and we work to reinforce these ideas pretty consistently. So, for example, we enact our assessment system. We train the faculty, and then whenever any sort of resistance happens, we work to kind of bring them back to the overarching goals so that we can kind of keep everyone on the same page. The second chapter of Folin was really devoted to understanding change, and that's I sort of use these different pieces related to my own problem of practice. So not to innovate the most, we didn't really want to reinvent the wheel. We knew other medical schools were doing these sort of changes and were changing their assessment system. So really diving into the literature and making sure that we're doing our best to follow what's already out there. And so not to have the best ideas, we need leaders that need to recognize their own strengths and weaknesses and then work towards improving those weaknesses. And then if you have a weakness as a leader, you should recognize that, maybe this one faculty member has that strength, and then you could bring them on board to sort of work on that one piece. So appreciating the implementation dip, I talked about that a little bit in the last slide about resistance. So our implementation dip really came with sort of resistance from the vision, and then trying to get everyone back to square one. And then redefine resistance. Again, educate. So whenever it pops up, we just, bring everyone back on board. So for reculturing, we worked to make the uncomfortable comfortable. People were doing sort of the same curriculum, the same processes for years, which can be very uncomfortable to sort of get out of that sort of that comfortable swing of things. So again, reculturing them to embracing the new curriculum. And then the last was never a checklist, always complexity. And obviously there's going to be speed bumps in the process. COVID was a huge one. We still enacted our first cohort in the fall of 2020. Potentially we should have waited, but we were wanting to get that curriculum going, especially since we had promised students that that's what they would be starting that year with. Chapter 3 of Folin talked about the importance of relationships. I think our new vice dean did this wonderfully. The leaders must recognize at their core that their followers want to, contribute to the organization. Obviously, just having a general positive outlook of, what people's intentions are. So moving from a product first to a relationship first formula is important. And just, I think, generally knowing that change brings about ambiguity, stress, anxiety, and leaders must exhibit high emotional intelligence to sort of combat any resistance that is going to happen. Sort of this general idea, too, is if followers aren't exhibiting signs, then it's probably a good indicator that there's stagnation happening, and that almost looking out for those things is sort of a sign that things are going well. So I had to talk about Alvarado, very important sort of case study, looking at New York City versus San Diego. I really think we were closer to New York City than San Diego, looking at sort of the bigger picture. The only thing, again, was sort of the timing, which I thought was a little bit closer to San Diego. We had to enact this curriculum quickly. And obviously, with COVID happening, we thought we would have more months together to sort of really iron out things, and we had to do a lot of that from home. So maybe needed to start it a year later, but there was, money and things tied, sort of the politics tied to starting in 2020. But we really sort of worked out those details when we were able to get back to the office. I sort of mentioned this before, but our office actually used the stages of concern model to survey faculty and staff in regards to the curriculum redesign, which was sort of interesting when I learned about that in class, because I've heard that before. So it is a biannual survey. It's sort of created to measure where participants or the faculty or staff are on the continuum. It is anonymous, but they do know what unit the data comes from, so they can work to sort of give personalized sort of in training, especially if people are still low in the stages of concern. I honestly think a lot of people are probably still in this task management stage. We're only 2 years in, which sounds like a long time, but in higher education is not very long at all. So in the next coming years will be us working towards moving people over to impact. So probably a big thing about, obviously refocusing and collaboration. So when discussing systems thinking, I think of this assignment we sort of had to do in the research seminar, sort of talking about, all the pieces that sort of fit into a project, all the different players. And I kind of created this infographic sort of based upon that assignment. But this was all the different pieces, cogs, if you will, that came together for us to realize that we needed to have formative feedback in the newly designed curriculum. So I probably won't go through all these different pieces. We talked about sort of the environment, the growing health concerns of Georgia. We have the people involved who are assessment leaders. We have sort of the prior approach to the curriculum and then what we wanted to move towards. We used Miller's pyramid as a theory of, getting people, using formative feedback to get people to the next stages of sort of development in a certain skill or behavior. And then our procedure is the assessment subcommittee that I discussed previously, of sort of making sure that these things are actually happening and that we're doing it well. So though we haven't used social networking analysis in this project, I do think it would be an interesting tool potentially for the future. I think one of the major issues that people are having with this curriculum redesign is, carrying on with their old tasks while adding all of these new tasks. So potential would be, conducting this social networking analysis to sort of see where there's breaks in the communication, or if someone's more overloaded with tasks related to the redesign. So I think it would be a good tool to potentially use, but we just have not used it yet for this project. So I wanted to sort of finish up my presentation with sort of how we finished up the course, which was the book from Bowman and Gallos. The biggest takeaway, or the thing I liked the most about this book, was just sort of this interesting idea of leading from the middle. So even though you might be at the top, or like my boss, obviously they have a boss to report to as well. Even the President of the United States has someone they report to. So it's sort of this idea of like, how do you balance the people above you and the people below you? Because sometimes sort of their visions or their goals might contradict one another. So for my own personal problem of practice, this was really working to keep faculty and students happy while fulfilling the vision of the curriculum redesign, which is from above, and the faculty and students are sort of the people who are on the ground and might not see the bigger picture. So it really comes back to what we were talking about with education, creating one-pagers, bringing faculty in for faculty development to really understand why we're doing these things, and that they actually, we really truly believe that these things are going to be for the better, even though they might not see it at this point. So, and then sort of just this balancing act. We had a recent example of trying, we're talking about formative assessment, and we have from the top, we have people wanting us to associate grades with formative assessment, which just really goes against sort of an inherent idea behind formative assessment. So sort of this balancing act of like, how do we make the leaders happy while also making sure we fulfill the needs of what this curriculum is intended to do. So that's really all I had for this presentation. Obviously, currently still in the throes of this problem of practice. It's been a wild ride. I've learned a lot, specifically with formative assessment. I do think, like I've mentioned, I think we're doing the right thing. It's really just kind of getting everyone on board to see why we're doing all this. But thank you, and I hope everyone enjoys the next month before the fall semester begins. Thanks.